Good morning, everyone. Good morning. Welcome to Mental Health Cooperative. My name is Michael Kirshner. We're so glad you made it this morning. I wanted to say the Crisis Treatment Center has diverted our first crisis by not having any snow or ice this morning. And we've even gotten the sun out, so it's an amazing morning. We're so glad you're all here. You know, we recently celebrated Martin Luther King Jr. and his I Have a Dream speech. You know, Pam Womack, our CEO, and Amanda Brock, our Senior Vice President of Clinical Operations, you know, they also had a dream. Several years ago, they had a vision to one day build a state-of-the-art crisis center on this very campus, actually in this very spot, that could better meet the needs of Nashville's rapidly growing and changing population. A 24/7 facility based on best practices with all services needed under one roof, where you would be proud to bring your loved ones should they ever need, yet safe and secure enough for those struggling with the most serious of mental health challenges, where our community is strengthened by a united belief that persons experiencing the extremes of mental illness should be treated with dignity and compassion in an atmosphere of acceptance and unconditional positive regard, where science, hope, and human potential will take the place of handcuffs and jail cells whenever possible. With some help from our friends, their dream has become a reality. And today we stand here in this beautiful space, ready to serve those in need. Our first presenter this morning has dedicated 26 years to MHC, where her dreams continue to become a reality and inspire us all. She continues to provide a powerful voice for some of our community's most vulnerable citizens. She can be found climbing mountains all over the world, breaking a sweat at jazzercise. Yes, jazzercise is still a thing. Or cheering for our Titans, rain or shine. I don't think she's ever missed a Titans game. She is our founder and CEO of Mental Health Cooperative. Please give a really, really warm welcome to Pam Womack.
Thanks, Michael. Many of you were here with us last March in a very blustery day when we did the groundbreaking, and I look out over the room and see many of you here today on another very cold day, but we did avert the snow, so that was good. And we're actually ahead of schedule. When we first started talking with our construction crew, we were told, given a date, and we're actually 2.5 months or maybe a month and a half earlier than we thought we were going to be, and that to me is quite a miracle in itself. The Crisis Treatment Center represents a long-standing and positive partnership with the Metro Police Department. And many of you may be surprised to know that on July 15th in 1999, 20 years ago, the then police chief, Emmett Turner, signed a general order directing officers picking up someone they suspect to have a mental illness to bring them to the Mental Health Cooperative Walk-in Center for evaluation. This police walk-in center was the first 24-hour walk-in center in the state, and that was in 1999, 20 years ago. The way we figured it, we already had our mobile crisis team here 24 hours a day, so why not open the doors to the police and the community? And that's kind of how we started. We started very small first with only one police precinct, and then broadened the service to anyone in Davidson County experiencing a mental health crisis. Today, our walk-in center has grown to this state-of-the-art crisis treatment center that can not only evaluate persons, both adults and children with mental illness, but also offers immediate psychiatric treatment for them so that they remain out of jails, out of emergency rooms, and return back to their lives in the community. This new facility is special and unique in that it represents a 3-part public-private partnership in terms of funding support. First, we have received Nashville Metro dollars through the mayor's office, which is providing funding for increased medical staff who can begin treatment as soon as a person walks in our door. Second, it represents state dollars from the Department of Mental Health and Substance Abuse, which has provided funds for the construction of this facility. And third, we as the Mental Health Cooperative have provided match dollars as well as providing the acre of land we're standing on. Some of you were laughing when they came in that we had an acre of land here, if for those of you who have never seen the co-op, that was just sitting here. And we tried so hard to use this acre of land for a crisis center for children, we tried to give it to the state and nobody would do anything, so we said, well, we'll just move our crisis treatment center here. So we are on this acre of land, and it's a great day. So I want to introduce now Amanda Brock, who is our Senior Vice President of Clinical Services, and she'll tell you a little bit about what the services we're offering here are. So thank you.
Good morning, everybody. As Pam said, the Crisis Treatment Center is special. It represents a true partnership among the private and public sector. This partnership will allow the Mental Health Co-op Crisis Treatment Center to provide a full continuum of crisis services for individuals experiencing a crisis. So, when I've been talking about this over the past year, I've been asked, okay, what are those services? Tell us what that means. So here's my best way of explaining it to you all. First, we will have a 24/7 ability to assess and provide immediate treatment for individuals who are both adults and for children. As y'all came in, many of you came in the adult entrance, but hopefully you'll stick around for the tour and you will see the child entrance, which we tried to make it as child-friendly as we can. When the individuals enter our walk-in center, they will be greeted by a multidisciplinary team. And this team includes crisis counselors, many of which are licensed in their discipline and who have many years of experience doing crisis work. Nurses, psychiatric providers, including psychiatrists and advanced practice nurse practitioners, resident counselors, mental health technicians, peer specialists, and discharge planners. And before I forget, for those of you who are in mental health, I'm often asked, well, what about mobile crisis? Well, mobile crisis is still mobile, and they will be working out of this location. We put all the staff together to aid in being able to provide the most comprehensive treatment possible and to engage people and have better communication amongst the treatment staff. We will also have a 24/7 secure location for our law enforcement. This will allow them to bring individuals who are in need of immediate treatment into a separate location that's to the side of the building, where the individual does not have to be brought through a busy lobby, but they can come straight in and be met by treatment staff. The treatment staff will greet the officer and the individual in crisis in a secure area that is not only safe for the consumer who's being brought in, but for the police officers and the mental health staff working in the facility. The team will get a report from the officer and then release the officer back to the street to do what he or she does best, which is providing safety and security in our city. And then mental health will take over providing the care for the individual. Our goal has been and will continue to be to provide treatment in the most least restrictive manner possible for that individual. However, there are times when people need hospitalization. In our current state of affairs, sometimes getting a hospital bed takes a little time. And this facility will allow us to provide care and continue to try to engage the person in treatment while we secure that hospital placement. Again, it's the right thing to do. It's more humane for the individual. And in many cases, if they're here with us and we continue to try to engage, we can start initiating treatment and maybe avoid an unnecessary hospitalization for that individual. Also, for those individuals who need longer-term care, we have a 15-bed crisis stabilization unit that is adjacent to this building. Some of you were here when we opened that facility back in 2012 at this location. We also have an 8-bed respite program that, again, is adjacent to this. We will be able to access those services via a secure pathway behind the gates that, again, is secure for the individual in crisis as well as the staff who are working with them. I have to tell y'all a little bit about when we rolled this project out to our staff. It's about a year and a half ago. We had a vision for this, and Adam Graham, our Director of Emergency Psych Services, opened up the staff meeting with a quote. And this quote is from Martin Luther King Jr., and it is, "The time is always right to do what is right." I think that quote really sums up the tone for the work we have done and will continue to do here at the Crisis Treatment Center. It is the right time for our community to have access to comprehensive psychiatric care in a facility that is well designed for their proper treatment and for intervention. I have to thank our community partners, many of who are here today, the health department, the work that they have done to pull together a collaborative group of stakeholders has been tremendous, and we would not have been able to do this without their assistance. So thank you to all of the people at the health department and the Community Mental Health Systems Improvement Committee. Gosh, I said that and didn't mess up that long name. Woo. And then our friends in law enforcement, many again who are here today, they have struggled with us. They have been here with us throughout many of, how shall I say it, some high intense situations. We, at times, have had to put our heads together to think outside the box, because those of you who work in crisis know that there's not a policy or a roadmap to address everything that walks in our door. And our friends in law enforcement have been great to work with us in that regard. I also have to thank the Department of Mental Health and their leadership for, again, providing the funding, but as well as guidance as we move forward with this project. Last but not least, I have to thank the staff who've worked so diligently to make this a reality. We have a team of people who are really special and very dedicated to their work, and I'm immensely proud of what they have done. They have combed over the blueprints. They've said, no, you got this wrong, we should do this, we should do that, you forgot this, you forgot that. They're not afraid to speak up, and I love that about them. So thank you to all of those folks. And certainly, last but not least, thank you to our leader, who has really challenged us and has been a visionary to push us to strive for bigger and better. I don't think we ever thought we would get to this bigger and better, but so glad we did. So thanks again to Pam Womack and her leadership.
Thank you, Pam and Amanda. Our next presenter was gracious enough to follow through on a commitment from our former mayor to offer remarks at our groundbreaking. He had been in office for less than a week, if I recall correctly, and we were, I think, your very first groundbreaking event as mayor.
Didn't remember anything.
I know you've done 1,000 since then. We greatly appreciate his return and continued commitment to mental health issues confronting our great city. Please give a tremendous welcome to the Honorable David Briley, Mayor of the City of Nashville.
My first visit here is a blur. I vaguely have a recollection of being here. It was cold. That's all I remember. I do want to acknowledge a few people who are here, but before I do that, I want to acknowledge one person who is not here. That's Governor Bill Lee, and he deserves credit, even though he is not here, because he made the clear, correct decision to keep Commissioner Marie Williams in her post. I know Dr. Ariola is here from the Metro Public Health Department. I know Senator Brenda Gilmore, my former colleague on the council and newly elected state senator, I assume for this district, is this your district? Yes. Is here as well. I know Judge Linda Jones from the Davidson County General Sessions bench is here. I know Deputy Chief Huggins, I think he is here. When we talk about the police and their interaction with this facility, there's probably no one more connected to that and more deserving of credit for the efforts that our city is putting forward here. I'd like to, again, acknowledge Pam Womack and everybody who works here at the co-op, because it's clearly more than just a job, right? This is a passion, this is a commitment, this is more than a job, and thank you for everything you do for this city. I'd like to acknowledge the members of my Behavioral Health and Wellness Advisory Council. I met with them just a few days ago, and they came with a list of, I won't call them demands, almost recommendations, let's say recommendations. And they've been doing hard work, and I appreciate everything they've been doing. One of the things we did talk about was whether or not the city would continue its financial commitment to the operation of this facility. And I did make, on behalf of my office and myself, a commitment to continue the financial support on an operational basis that the city is giving to the co-op. Council members Larry Hager and Sharon Hurt are here joining us as well, and you can lobby them to follow through on that commitment at the end of the speeches, because they'll have an opportunity to vote on that commitment this summer during the budget process. And I'm sure their presence is a strong statement of support, correct? Thank you. That's 2 votes down. 19 to go. This weekend, here, our city will start providing a new service to our community, immediate, comprehensive, and compassionate treatment around the clock for adults and young people suffering from a mental health crisis. And that is good news. It's good news not just to those individuals who were suffering in that crisis moment, but to all those people that surround them. My own family, I have 8 cousins, and I've lost 3 of them to either suicide or overdose. So that's not that unusual. People in crisis deserve quality care that is safe and timely and comprehensive. And this new facility gives us a new way to help people who need that immediate mental health support while letting our police officers get back to work. As mayor of this great city, I am committed to making sure that we provide an equitable opportunity to everyone who lives here, to providing social justice and programs that lift our residents up. And in that context, it's especially important to me that we identify programs and solutions that are going to improve the quality of life for the people who live in Nashville. For too long, we looked at mental health and addiction as being the wrong thing. We didn't, as a world, as a community, especially here in Nashville, acknowledge that it was a disease. It wasn't some sort of lack of willpower on behalf of an individual, but it was a disease in operation. And this facility is our city's truest commitment to an acknowledgement that it is a disease, and that if we are truly going to lift everyone up, we have to start providing the kind of care, the kind of support, the immediate, compassionate support that is needed to lift our community up. Every time we do that, it probably saves us money because we have fewer interactions with the judicial system. Fine. That's great. But it's not the point. The point is that if we're going to fulfill our role, if we're going to do everything we can to make this a compassionate, just place, we have to make sure that we are providing the kind of care that we know will work, that changes people's lives, not just those suffering from a mental health crisis, but all that surround them. The parents, the children of people who are suffering, all suffer as well. So we have got to do more. This is a part of the commitment. Each and every day, as long as I'm mayor of this city, we are going to work hard to find additional ways that we can transform lives here in this community to make sure that people prosper, succeed, and live a fulfilled life. On behalf of your city, I want to thank each and every one of you for being here today, because your presence demonstrates that you care about the people living in Nashville. Thank you to the co-op. Let's get to work. Let's open this weekend. Thank you very much.
Thank you so much, Mayor Briley. To bring us home today is someone who brings a ton of energy and passion to her work. I don't think anyone would deny that. She has a special talent for gaining alignment toward reforms that improve lives across our state, most recently in the areas of opiate dependence, emergency psychiatric services, and criminal justice. As Mayor mentioned, she was recently reappointed Commissioner of Mental Health and Substance Abuse Services by Governor Bill Lee. Her smile always lights up the room, so everybody prepare yourselves. Please welcome our great friend, Commissioner Marie Williams.
I'm really excited to be here today for this incredible grand opening. And Mayor Briley, your comments were right on target. I met Pam Womack 28 years ago. I was sitting over there thinking about this, Pam, and I'm off script, Matthew. I was thinking about it because 28 years ago I was at Midtown Mental Health Center in Memphis, Tennessee, and we had a small crisis stabilization unit. And when I say small, I believe it was half the size. You recall that, don't you? of this place. Pam has been what I would call the Joan of Arc of mental health. And truly, none of us would be here today if it were not for her vision and her stewardship and her passion and her kindness and her care that we treat everyone, no matter who that one is, the way that we would want to be treated. I remember the first item that Pam brought up in the whole community mental health system. It was amazing. That item was when I was a young case manager, 27 years old.
I was young too.
Yeah, you were young too. And that item was whether or not we would have bathrooms that all people would use. Now y'all think about that for a minute. That was only 26 years ago. And I remember Pam being the first executive director that said, everyone can use these restrooms. We're not going to have staff bathrooms versus the people that we serve bathrooms. I was really, really touched and really motivated in Memphis, Tennessee by what you said and what you led. Mayor Briley, Senator Gilmore, other dignitaries that are in the room, as well as our incredible team at the Department of Mental Health and Substance Abuse Services leadership, Bo Turner, who's our Deputy Commissioner, Matt Yancey, who's also our Deputy Commissioner of Community Behavioral Health Services, Marina K. Murphy, who serves as the Director of our Crisis Services, and Maria, who works with her. We also have Rob Cotterman, who serves as our Assistant Commissioner of Mental Health Services, Melissa Sparks, who's been a spark plug for all of us all these years. And then we also have Justine Bass, who's here. When I walked in, how many of you heard the song, It's a Beautiful Day? It's a beautiful day. I mean, isn't it a beautiful day? We thought it was going to be a horrible day. We thought it was going to be a snowy day. And we got told y'all were doing this come rain, sleet, snow, or shine. And here we are, it's shining. Talking about the vision and leadership, I was at the office yesterday and Bo Turner mentioned to me that in a prior life, in a less worthy life, when he was working in a different area, and he knows what I mean by that, and I mean that as a joke, that he was with you, Pam, and you pointed to this ground and you said, this is where this facility is going to be. Without a vision, the people will perish. She has the vision. I'd also like to thank the people in our legislature as well as our former governor, Bill Haslam. He called me up and said, Marie, I think I'm going to add $15 million to your budget. What do you think about that? I mean, how many people get a call from the governor or the mayor that say, we're going to add $15 million that you didn't think you were going to get? And what it would do is to create pre-arrest diversion sites and crisis units across this state. It's been unbelievable. These have been funded across the state, and I must say this one is absolutely beautiful, Pam, and how you're leading it is beautiful. Amanda, being over crisis is not easy. Matt Yancey has said that a crisis knows no time frame, and we know that your staff that come here every day, that are here in the morning and at night, also know that crisis knows no time frame. Thank you for not getting burned out. Thank you for keeping on fighting the good fight, because we will need people like you as we move forward. We want y'all to know that from the state's perspective and with the extra money that Senator Gilmore is going to give us, she's writing the check right now. That what we're going to do is try to expand recovery options just like this, so that when a person is in their highest need, when a person is at their lowest point, and when a person is contemplating ending their life or giving up because they're addicted, that they will be met by warm, compassionate, kind, informed, and clinically savvy individuals that say to them, this is not a death sentence. This is not the end. This is simply a journey, and it's part of recovery. It's part of recovery. Thank God in this state we have partners like TennCare. Give them a big hand. Because if we didn't have partners like TennCare, and if you look at other states and you see what their options are for services, we wouldn't be here today. Because this truly is funded by a multitude of different partners. So with that, I will end by recognizing another incredible mentor and leader who is part of our past, from which we stand on her shoulders, and that's Assistant Commissioner Melanie Hampton. She's here. Melanie, you've taught so many of us passion and commitment for what we do. And then Darren Gordon, thank you for being here, and thanks for what you've done to serve people that have mental health in our state. Again, thank y'all. It's a beautiful day, and thank you for allowing me to be here.
Wow, that's a tough act to follow. I just have a few special quick thank yous to tie us together here. We wanted to thank Smallwood Nickel Architects who worked on this building, Jim Nickel and Brandon Holcomb. Where are you gentlemen? They're in the back. Thank you so much. Schaub Construction Company, Jay Brassfield, Jason Hall, and Steve Easterling. Are you somewhere where we can? They're also in the back. Thank you so much. I just wanted to quickly thank 3 co-op folks who have been instrumental in putting this project together. First of all, I wanted to thank Adam Graham, who never takes the spotlight. Well, I shouldn't say that. He's always in the media, but he never takes the spotlight around here. Adam Graham is our Director of Crisis Services, and you'll see him in the media constantly, and he's a terrific young gentleman. Also, I wanted to thank Peggy Hoffman, our Chief Administrative Officer. Peggy's back here, and I know she doesn't like to be the center of attention, but Peggy has managed this project before it was even on paper, and she has been there every step of the way, day and night, and this never would have happened without Peggy. So thank you, Peggy. And Bob Bouchard, our Facilities Coordinator. Bob, is Bob in the room? Bob, hopefully you can hear me. Bob as well has helped manage this project from beginning to end. So Bob, we couldn't have done it without you. Melanie Hampton, who Commissioner mentioned this morning, she said it a little bit ago best in the other room. She said, "We've sure come a long way, baby." And when I think back to even when I started here to where we are today, I just can't believe it. So Melanie, thank you for sharing that prolific, those prolific words with me. We have Jacob Henry, one of our crisis supervisors over here, the gentleman waving. He has assembled a masterful group of tour guides. They are mostly our supervisors from our crisis area, and they would love to take each and every one of you on a tour of this facility so that you can see what we've done here. They can do small groups, large groups, individuals, however you'd like to do that. He can take a group now, or if you'd like to go have some coffee and some refreshments and then come back, they will be here as long as you're here. So we want everybody to have a tour. We are absolutely honored that you've all taken the time to come out today, and thank you so very much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.